Hello, welcome to the Pediatric module of the International CML Foundation Knowledge Center. I am Dr. Nirmalya Roy Moulik, a professor in Pediatric Oncology at Tata Memorial Hospital in India. I'm really glad to introduce this module as ICMLF is launching this module to mark the occasion of International Childhood Cancer Day. I'm really indebted to Professor Giuseppe Saglio for conceiving this pediatric module in view of the fact that adult and pediatric CML are so different. I'm also co-chairing this module with Professor Meinhof Sutorp from Germany, and we intend to cover all the relevant aspects of pediatric CML in this module. Currently, we are launching the first set of talks by 4 experts in pediatric CML. Firstly, Professor Sutorp from Germany, one of the most experienced and internationally acclaimed names in this field, has provided a very fascinating and insightful talk on the issues around parenting in children with CML. He alludes to various real-life scenarios and highlights the importance of good communication in clinical practice. His vast experience makes this talk very impressive and very lively, and I'm sure it would be useful for physicians caring for children with CML. We have Dr. Stephanie Simbel for the second talk. She's a pediatric oncologist from Germany. She's also one of the members of the International Pediatric CML Expert Panels and is the lead author for their recently published guidelines on managing pediatric CML in blast phase. She talks about blast phase CML, which is a great synopsis of the guidelines that has been recently published. As most of you know, blastic phase CML is very difficult to manage. She provides a lot of insight into the management of blast phase CML. She also covers clinically important aspects, for example, how to differentiate between Ph-positive acute leukemia and blastic phase CML. She also touches upon the issues around transplant in the setting of blastic phase CML and also the timing of TKI usage in this scenario. In the third talk, we have Professor Nokubo Hijiya, who takes us through an important aspect of stopping TKIs in children with CML. Professor Hijiya also doesn't need much introduction. She is from New York, a very well-known face in this field, and she is currently leading the COG study on TKI discontinuation in pediatric CML. Unlike in adults, where TKI discontinuation is a standard routine care, in children it is not due to want of data. In her talk, we get to hear the nuances of TKI discontinuation derived from the adult studies as well as the available pediatric data. She also discusses important concepts like having to take these patients for very quick response to make them eligible for discontinuation, which is probably more important in the setting of pediatric CML because these children encounter long-term off-target toxicities of TKIs in their growing phase. So I'm sure it would be a very fascinating talk for all of you. We have also got a talk from Professor Frédéric Millot just in the last 2 days. Professor Millot is from France and is a very well-known name in the field of pediatric CML. He's currently leading the ICMLF, currently leading the International BFM Pediatric CML Registry. He takes us through an important account of how to manage pediatric CML in chronic phase and also covers some previous data from use of imatinib in children as well as adults, define the treatment milestones. He also gives us a flavor of ongoing studies in pediatric CML in chronic phase. Most importantly, he takes us through the upcoming IBFM pediatric CML chronic phase management algorithm, which will be of tremendous use to pediatric practitioners who treat pediatric CML. Thank you. In the last talk, we have Dr. Mine Lusing from Princess Maxima, Netherlands. She's a pediatric oncologist and also a member of the International Pediatric CML Expert Panel. She talks to us about the non-endocrine toxicities of TKIs. This talk is also very important and informative to the pediatric practitioners and provides guidance on how to approach such toxicities in children. I'm sure that these talks and those to follow will be a great learning opportunity to all concerned. Last but not the least, I would like to thank and express my gratitude for the commendable job that Dr. Arlene Harris-Buchan and Nicola Evans from the ICMLF have done to put together this module. Hope you enjoy the talks. Bye-bye.